We are the Medical Society Consortium on Climate and Health, a coalition of doctors and health professionals mobilizing support for climate solutions that will protect and promote health, equity, and resilience for all Americans.
I realize how this is really a unifying concept for public health, primary care, general medicine, emergency medicine, disaster medicine.
It's now, it's urgent, and we got to alert everyone at home. We got to alert everyone in the community. We got to alert our politicians.
And if we all contribute just a little bit, it makes a big difference.
Hi, everyone. I'm Rebecca Rehr, Director of the Climate for Health program at ecoAmerica. Climate for Health is a national initiative led by a diverse network of health leaders and organizations designed to empower health professionals to speak about, act on, and advocate for climate solutions that protect personal and community health. I am honored to be here today with Dr. Georges Benjamin, Executive Director of the American Public Health Association, Dr. Fan Tait, Chief Medical Officer at the American Academy of Pediatrics, and Dr. Sacoby Wilson, Associate Professor at the University of Maryland School of Public Health. You may have noticed that I, like a few of our panelists, are in our kitchens, joining you at the American Climate Leadership Summit. And that's because we are going to ask our speakers and engage you all in discussing the ingredients for a conversation on climate and health that drives the change we need to see. Please check out the Action Center on the right side of your screen, where you will see a survey. If you toggle over and take that now, we'll look at our responses together in just a bit. And don't forget to engage with us on social media with the hashtag ACLS2020Live. Our first question is for all three of our panelists. We want to start out with, what have you found to be the most effective ways to talk to people about climate and health that inspires their ambitious action? And just, is this the same answer you would have given 9 months ago pre-pandemic? So Dr. B, why don't we start with you?
Hi, so I'm Georges Benjamin at the American Public Health Association. And of course, a lot of my members are out actually having to deal with COVID. There are some people living with COVID. We're actually working on COVID. And the answer is, we always want to talk about this as a kitchen table issue. Some talk about heat and talk about the challenges of your health and how it impacts people on a daily basis. I think what makes it most different with COVID is that, we're having to deal with the heat, and yet the pools are closed. We're having to deal with the environment, even though now that we're in our homes, it's a little cleaner. But as we begin to reopen, we know that we're polluting the air again. So I think if anyone has any question about whether or not humans are behind climate change and our actions around climate change, tragically, COVID has given us a randomized control experiment in what we do if we start driving our cars around and burning fossil fuels.
Fan, go ahead.
Hello, everyone. Welcome to my kitchen. I'm honored to be on this call today. As Georges was saying, and we were just saying, what are the ingredients? I think it's really important that these kind of discussions happen, as you said, right around a kitchen table. And from a health perspective, I think these discussions need to be happening when we're with patients, with families, and otherwise. So whether it's in the kitchen or in the office, around an exam table, I think we need to be having these kind of discussions. And your first question, Rebecca, that was looking at, is it different now? Oh, yes. And George's, oh yes, the world has changed, I think, and not for the better. And I think that the people who are impacted the most are the people that have always been impacted the most. So when we think in terms of justice, and Dr. Wilson, I know we've been on a panel before, and I know you're going to be dealing with that, so I'm not taking thunder from you, except to say it's horrible, and it's getting worse. And it's not fair, it's not right, and that's not the way it should be. We're gonna have to look at that. If I may talk just about effective ways to talk with people about it, or I don't know if you want to go to Dr. Wilson first. I'm going in then. I'm going in on this one. Thank you. So from my perspective, the most effective way is talking to parents, right? What every parent wants to know is, how's my child doing, right? Am I a good parent? Am I doing the right thing for my child? And they want to know, I get a little passionate about this, but they want to know, they want the world to be better for their children than it was for them. Even if they had a good life, they want that. And so I think when we're talking to families, what we want to say to them is, we know you want the very best. You want health. You want the mental health. You want the environment, and you want them to be well and happy. And so the way I look at this is that we have an opportunity from the medical profession that we are still, thank goodness, trusted sources for information. We look at that all the time. I'm a pediatric neurologist and work at the American Academy of Pediatrics. So we want that to continue. And if we're the trusted sources, then we need to have honest discussions with the families. And I was just reading something just this week about social determinants of health, of course, and that climate change. So we're always asking our members to look at social determinants of health. And one of the things is that climate change is a social determinant of health, however you want to look at that, at least I believe. The last thing I will say on this, two quick things. Children are not just little adults, right? And so the things that are affecting children are exacerbated, or can really be exacerbated. So we want to do that. And listening to the earlier presentation, I think that the other thing that I think we need to say is, I personally believe that the science is clear, right? I personally believe that, because if we're the trusted messengers, you can say, I know you're hearing all this stuff. I know you don't know who to believe. You hear about not trusting science, but you can say, I know this to be true, and then have an honest conversation about that. So I'll stop with that. Thank you.
Yeah, thank you for the opportunity to share. When it comes to climate change, I think it's really important to talk about the climate change science, the little s, as Dr. Benjamin said. We got to talk about climate change and make it proximal, make it everyday, make it pocketbook. So talk about, as the panelists have already said, connecting climate change to food, to faith, to family, to health, and to jobs, right? I mean, we have science in everything that we do. The fact that we have science deniers, they're denying the science that they were wearing when they were denying science, the science in their car when they drove the location to deny the science, the science that they turned on to put on the clothes so they can get on the microphone to deny the science. The science in everything that we do. So we have to rebuild that trust, that follow on Fan's point about science, and communicate science in a way that makes sense to people. You know, we got to increase folks' literacy on science and climate science. And then you think about climate change, for the communities that I work in environmental justice, you can't talk about woe, doom, and gloom. They're already struggling. How can you talk about climate change as an opportunity? How can you talk about climate change as the future workforce? So for the communities that are hosting the power plants, hosting oil and gas extraction, hosting the refineries, hosting the pipelines, being extracted from, how can we get back to them and looking at climate change for workforce development? Not just living wage jobs, but creating microeconomies where people, renewables, geothermal, solar, wind, hydro, electrification, making sure electrification is not just for the rich, but also for all communities, regardless of income, making sure that we have electric grids, smart grids in low wealth communities. Community folks who, we should have a human right to clean air, clean water. We should have a human right to energy. You shouldn't have to be worried about your lights being turned off. You shouldn't be worried about your water being turned off because you can't pay your water bill, right? These are all related to climate. These are all related to how do we value, folks who are dealing with these issues. As we said, we're going to be disproportionately impacted. Climate change, as we know, is a driver, right, poor health outcomes. Climate change exacerbates environmental justice, but also it reveals environmental injustice, right? And then you ask the question about where we are 9 months later. It's just not COVID-19, right? COVID-19, now I said this before, it's made visible the populations that our policies have made invisible. Why are so many essential workers needed to go work? Because of toxic capitalism, or as Reverend Lawson said at John Lewis's funeral, plantation capitalism, right? We are increasing transmission risks and health risks for those retail workers, transit workers, healthcare workers, agricultural workers. I have 3 siblings who are nurses, right? 3 siblings who are nurses. You know, I have a niece who worked at a restaurant. She got COVID. She was exposed to SARS-CoV-2 virus and got COVID-19. What about those agricultural workers? What about the meat packing plants? What about folks working in prison? What about the prisons themselves? What about our homeless populations? Our policies have made those folks on the front line and fence line invisible, but COVID made them visible. And then you think about where we are today. All of a sudden, America woke up. Some Americans woke up. We have racism. I've been Black my whole life. I'm from Mississippi. I remember my first example of racism as a 5-year-old, right? So we have racism that's built into the walls of this country, founded in this country on the backs of enslaved Africans in the genocide of our indigenous brothers and sisters. So we've had 400 years of toxic racism and hate. We've had toxic capitalism. We have toxic pollution. We have toxic climate. We have a toxic virus. It's not a pandemic. It's a syndemic. So how do you address that? You have to have social justice at the core of all that we do. We have to have real talk. Say racism, say environmental racism, right? And then we think about climate change. It's just not good enough to talk about resilience. How are we going to not just restore communities? How are we going to do community building? We don't want to get communities back to where they were before the hurricane, back to where they were before the flood, back to where before the forest fire, back before they were when you had the heat wave. You know, this is the 25th anniversary of Chicago heat wave. We're 2 weeks away from the 15th anniversary of Hurricane Katrina.
Yep.
We have to do more than make sure that we are communicating science, but focusing on policy and focusing on real action. I'll stop.
And I hear, no, thank you. And I hear, and it's so, I so appreciate the enthusiasm you bring forward solutions so quickly, but also I think in this virtual space, I think that we can sense your emotion through the screen. I think really helps bring truth to power in what we're speaking about today, even though we can feel far apart. So I truly appreciate all those answers, and I'm hearing a lot about bringing forward solutions. You know, we know in our own research at ecoAmerica that when people make the connections between climate change and their health and their family's health, they are more willing and likely to take action. And so coming forth with tips on how to have those conversations and come forward with solutions, I think is critical. And so the next question is more about what you think the general public needs to see from the health sector to inspire their climate action. So what could the health sector be doing more of or isn't doing yet that they should be doing? And this question, we also want to hear from our audience. So if folks want to type into the chat box what you want to see from health professionals, you know, we can tie those into our recommendations. So Fan, why don't we start with you on this one? What does the health sector need to be doing more to inspire general public action?
Thank you. So as I was thinking about this question, I think it's really important, and that we look at consistent and understandable and meaningful and culturally humble messaging with everyone, right? And this is, you can't, from my perspective, you can't have health over here and faith over here and communities over here. And so I'm so excited that we are all a part of this together. But I do think that it's important that we look at the right messages given in the right way at the right time, so that it's not just about messaging. So please don't think I'm saying, oh, we just need to say it right. I'm not saying that. But if we're looking at 50% of people who believe what we're saying, 50% who don't, then I think it is important to look at the messaging and we all have, and we will continue to do that. So I put down second, partnerships. So I think that if we're not looking at the groups here, but also looking at who's not here, who's not around the table with respect to the partnerships, then I think we're failing on that, and we need to step out. And we don't have to lead, right? We don't need to lead. We need to be a part of those solutions. And I think that's really important. I think that we need to continue to look at policies. Sacoby just talked about, you can have all of this, and if you have policies that reinforce the racism and that reinforce the inequities, then we're just spinning. So I think we need to look very specifically at the policies. I think we need to look at this from a health perspective and a pediatric perspective. We need to look at this from anticipatory guidance, right? Just like we ask about housing, just like we ask about food, just like and how do you link those together? So that was one, and I'll wrap up quickly here. I think we need to do more to set examples for others. So if you're doing one thing and you're saying another thing, hard for people to believe. And that's in hospitals, that's in practices, and that's personal too. So we have to look at all of that. I think we need to think of change as a social determinant of health, and how do we link those? Mm-hmm. Unfortunately, we're looking at prevention of the worst, right? And we also have to now look at preparedness of families. So you'd like to not look at that piece and just stop the madness, but we still have to help them in every way we can. Thank you.
And Dr. B?
You know, people come to the health sector to both improve their health and to be healed. And so I think it's important that we come to them with solutions and recognize that there are solutions to this climate crisis. First thing, of course, is recognition, and then straight talk. Being a trustworthy messenger is important. I believe that telling them, look, today is a hot day, the weather is terrible, and this is an impact of climate change. Your asthma is worse today. There are a lot of reasons your asthma is worse today. Climate change is probably a contributor to that. The severe storms we're having that impacted your health today, your inability to get to work today, the tree that fell on your house today. Tragically, all those kinds of things are happening more and more. And we have to have straight talk about that. I also think that we in the health sector have to walk the talk. That means that we have to make sure that we are both trying to reduce our own carbon footprint and in a healthy way. And then finally, making sure that our employers and our offices are constructed in such a way that they're also walking the talk. After all, we know that the health sector itself is a huge emitter of climate emissions. We like to put that CO2 in the air. We have huge boilers and furnaces, and we operate lots of stuff, and we create lots of trash. And so we've got to figure out how we as a sector take our responsibility and reduce that our carbon footprint. And then when people see that we're walking the talk and that we're being trusted and transparent in our messaging, then we can provide the leadership role that people expect of us.
Yeah, they've answered the question. I'll try to be succinct, Rebecca. You shouldn't stop being bad. So you think about solutions, right? I think the partnership is really important. I think professional associations should work together, like APHA working with American Planning Association, working with the schools of architecture, for example, ASBPH working together. When it comes to training, integrated training, so we have folks who understand to take an interdisciplinary approach to climate change. I believe on the community side, we need to let grassroots, fence line and frontline communities take the lead. I have a community partner in Charleston, South Carolina, Low Country Alliance for Model Communities. They've been doing work around the Port of Charleston. They have mitigation agreements with the Port Authority. They have mitigation agreements with Palmetto Rail. They have a statewide climate resilience network. They're part of the Moving Forward network to move away from pollution intensive goods movement, right? They're doing work around climate change. They're doing work around climate resilience. They're doing work to really empower their communities. You got the HBCU, CBO Gulf Coast Health Equity Consortium, led by Dr. Robert Buller and Dr. Beverly Wright, working in 5 communities, Houston, Texas. They're working with Lower Ninth in New Orleans, Africa Town, Mobile, where Clotilde, the last ship of enslaved Africans, Biloxi, and Pensacola, Florida, where they're working with communities to develop action plans, right, to address climate, disaster, EJ issues. You got EDF is working with folks in Houston, the APSO community, the Fifth Ward community. Again, action plans, community-driven plans to address these issues. We just got some funding from EPA recently to look at disasters and flooding in Eastern North Carolina. Because remember, Hurricane Floyd dropped was 11 trillion gallons of rain, Hurricane Florence a couple years ago. Eastern North Carolina, so toxic mix of coal ash and hog waste and chicken waste, right? And we're also gonna be working in Charleston, which has more industrial corridors. And how do you, using that data, work with communities to develop new community-driven emergency preparedness and action plans, toolkits, right? That's what we need. And then policy-wise, I think there's opportunities to think about how can we develop policies. Climate resilience is important when it comes to infrastructure, but what about policies as it relates to, again, building safe and healthy communities? So housing policies, green infrastructure policies, addressing food apartheid, the whole food, energy, water nexus, I think is really important to focus on, right? And so I think there's a lot that we can do. And then, as Dr. Benjamin said, walking the walk, walking the talk. I got a food forest at my house. I got everything but counting the chicken, right? I go out every day picking okra and berries and collard greens, right? We need to make sure that food sovereignty should be a goal, because that's going to help with greenhouse gas emissions. You growing your own food, you're not driving to get food. We got to invest in urban agriculture. We got to invest in getting young folks into STEM and into ag, and families really getting back the connection to the land. I'll stop there, but really, land is power, land is wealth, land is culture. That's an important part of the discussion too.
Yeah, absolutely. And I want to just pivot to our survey and read out some of the results that we were getting from our audience. And so our audience says, for the most part, they either strongly agree or agree that they understand the way climate change impacts people's health. They get it. The folks tuning in today get the climate change impacts our health. 87% of them are very concerned about how climate change impacts their health and the health of others around them. So most people are very concerned. The next question, how concerned do you think others around you are about how climate change impacts their health? Only 17% say others around them are concerned. So 87% of respondents today in our audience say they are very concerned, but only 17% think. I'm repeating it because it's a stark difference, and that is the same finding when we do it nationally. It's the same difference. So I'm going to ask, and it's one of the reasons we work in the sectors that we work is because we think that these, that health leaders, faith leaders, community leaders can help close that gap, help people understand that they are not alone in their concern. And so I will ask I'll ask you to reflect on that finding. People are concerned, but there's this barrier. They don't think others around them are concerned. What do you think about that, and how can we help close that gap?
I think that's definitely true, that people have they know what they know, but they don't know what other people know. That's why that kitchen table conversation is so important. You have to start with your family. You have to have the conversation so you have a sense on what they know and what they don't know, what they feel about this. And if you're enlightened and you understand the issues around climate change and the connection between climate change and health and the things that we can do to mitigate it and things we can do for adaptation, then you can help them move along. Same thing in the workplace, and we have to not be afraid to have these conversations about climate and health. We have to have them as openly. And people get in arguments over climate, but most people know that it's real. They understand it, and so these should not be confrontational conversations. They should be informative and collaborative conversation. People are hurting.
Yeah, I think Fan mentioned talking to adults earlier. I think one of the powerful ways is talking to kids, right? Think about the Sunrise Movement, think about all these movements of youth out there protesting against the, racial injustice, protesting against the fact that we haven't been doing what we need to do on climate change. You know, they're like, this is our future. And guess what those kids do? They go talk to their parents, right? They talk to their siblings, they talk to their friends. So, and they also using social media. Man, I don't know a lot about tweeting and all that stuff and TikToking, but you know, think about science communication, the young folks and how they're doing. I mean, think about the organizing the protests. They're using social media. So how can we use social media, right, to get people to understand, to connect better to each other? And also the digital divide between young folks and older folks as it relates to access, you know, the whole digital literacy, right? There's opportunities there. And I think, you know, and I think what it is how can we, as Doc already said, the kitchen table, you know, talking to each other is really important, and bridging, right? How can we build bridges to other groups that are not in our group, right? You know, how can we become more comfortable in having dialogue? We're in this, I think part of that survey is we're in a situation where we're so divided. So we need people who can bridge. We need individuals, we need leaders, we need organizations. And that's where this health sector is powerful. Your doctor can be your bridge, right? The nurse can be a bridge. United Way group, a local civic group. We need people to act as bridges. So I'll stop there.
And Fan, I'm going to ask you to respond to the next question in the survey, which was about, we gave a list of examples of concerns, and people voted for what most concerns them out of vector-borne diseases, air pollution, longer allergy seasons, harm from more extreme weather, and heat stroke and dehydration. The highest voted was harm from extreme weather. So 38% said extreme weather. 19, 23, and 20 for the other vector-borne disease, worsening air pollution, and heat stroke. So those were pretty closely linked. And then nobody is concerned about longer allergy seasons. And I have to say I'm a little surprised about that as a resident of Washington, D.C., where the allergy season is very real and very long and more frequent. But you know, Fan, what are your reactions to where people's concerns are about specific outcomes?
So I think it's all personal, right? What you're most concerned about is what you live, right? So if you're, as an example, so if you're in California right now, the fires, right? If you live in Mobile, from Alabama, if you live down there, you're worried about what's going to come off the Gulf there. Do you know what I mean? So you can look and say what, you know, we're all concerned about different things. And I think that's one way for us. I'm circling back just a little bit on the question below, because I think that you need to concentrate on people's lived experiences, right? So speak to that. And if it's in your home, George, like you were saying, or if it's wherever, that you know, you can start a question like, boy, it's really been hot this summer. What do you think? So, I mean, I know that I hope that doesn't sound condescending in any way, but it just opens up the conversation. Like, I've never seen it this hot. And so I've heard that when I'm home, and I'm like, wow, why do you think that's happening? You know what I mean? You just, instead of going at someone like climate change, you know, it's, what do you think? You know, yeah, I'm worried about the kids. I'm worried about our crops. I'm worried about, you know, fill in the blanks. So I think that it's not surprising to me that we see different things. And I think the reason we're not seeing the allergy so much is because that's not going to kill you. It may make you very miserable for a long period of time, but those other things we're talking about, you and your loved ones can lose your lives or the economy, or fill in the blank.
Yeah. So. And I'm just gonna, I know we're running a little short on time at this point, so I'm just gonna read out the last question and then take an audience question before we go into the final question. How can health professionals make the biggest impact? Overwhelmingly, you know, 44% say educating the public about health impacts of climate. And then there was a close between influencing other health professionals, presenting research and testimony with federal and state policymakers, and influencing their own community. Interestingly, 0% say publishing new research in peer-reviewed journals. So I'm just going to leave that there. Not going to turn it into a whole conversation about that, but very interesting. All right, let's take an audience question. Folks want to know, why do you think science, mathematics, and reality aren't being listened to or respected right now? And I'm going to ask for brief answers because we have one final question before we send it to the next panel.
I disagree. I think people actually do believe in science. I think we have a group of people with a large bullhorn who don't. But the average person believes in science.
Yeah.
Anybody else? Yeah, go ahead.
Yeah, I think there's a need to do better science communication. And the point about publishing is important. I'm the new editor-in-chief in environmental justice, which I think is great. But that publishing puts change in my pocket. That doesn't make social change. You need to be doing op-eds, press releases, white papers, fact sheets, creating maps. We got to be able to communicate science to the folks who can make the decisions. And I like to say, no politician goes to politician school. We need to be educating politicians. Community members have to get the opportunity to be in those spaces to tell their stories. So stories are the things that we need people talking about when it comes to these issues. I think people understand science, but the impact change, the ones that most impacted by the disparities, have to be pushing those policymakers.
And two lightning round questions to end. The first is, what is your one piece of advice, your guidance for up and coming climate leaders in the field? One piece of advice for up and coming leaders.
I think get engaged, get to know your policymaker.
For me, know your why. If you know your mission, you know your why. Regardless of the challenges, no one can stop you. So you can have that impact you want to have, but know your why.
And we need you. We need you. Look at what you can do and never give up, and know your why. I like don't give up. We need you.
And then what is your one piece of advice for folks trying to start a climate conversation that will drive change and advance equitable climate solutions? So Fan, kick us off for final answers.
So as I'm thinking about this, I would like for this to be, this is not about politics, right? It's become incredibly politicized. This is not about politics. This is about the survival and the well-being of the world. Sorry, going there. But I would say, if I'm thinking about a piece of advice, children's health is one way to elevate the importance of what's happening in this world, because everyone cares about it. I know I'm harping on that, and I apologize a little bit, but that's what will make it meaningful to everyone around us, one way. Thank you.
Yeah, I talk often about getting up every morning and being, wanting to be caring about other people's health. And I want them to all get up every morning and do the same thing.
I think the angle on children is important. I mean, how are you going to put America first? You can put your kids first. We got to think about children in every aspect. I mean, right now we're talking about weaponizing children going back to school. I mean, that's kind of state-sanctioned violence, right? Because of what's going on with COVID. So for me, children are at the core of what we should do. And then also from social justice perspective, focus on the family. Family, 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 family. That's the way to talk, to get people to understand these issues.
I cannot thank each of you enough for spending time with us today, for sharing your wisdom, and certainly inspiring people in this time where people are looking for connection and this type of conversation and inspiration. So I think we've covered a lot of ground in a really short amount of time, and hope that people can go forth and have these conversations and understand the grounding in health, and that we can take equitable climate actions to improve our health, our family's health, and our children's health. So just thank you so much for your time today and the work that you do on an ongoing basis. Virtual rounds of applause all around. So it is now my pleasure to pass the ACLS baton to my colleague at ecoAmerica, Annie Fett-Cruz, Director of the Blessed Tomorrow program, to facilitate a discussion with faith leaders. Thanks again.